Hello, Elevation Health friends and family. Dr. Dave Yachter here with our upcoming diabetes and blood sugar control workshop coming up. I have an important topic to speak with you about today, and this is going to be part one of a two-part series on diabetes do's and don'ts. Half of everyone that you and I know right now are either diabetic or on their way to becoming diabetic, being pre-diabetic. So in this episode, we're going to talk about the most important diabetes do's and don'ts because being diabetic or even pre-diabetic significantly increases your risk of vision loss, neuropathy, obesity, heart disease, cancer, Alzheimer's disease, and in many cases, tens of thousands of cases every year, resulting in limb loss and amputation. And so one of the most important concerns about diabetes is that when you're pre-diabetic, you don't even know that it's happening. And by the time you're diagnosed with it, it's too late. But when you are diagnosed with it, some of the most common medical treatments, as you and I know, first and foremost, come in the form of medications. And so one of the most common medications that we see given for a diabetic condition is insulin. The Journal of Clinical Endocrinology and Metabolism showed that insulin side effects are very real. And there's a concern here because type 2 diabetics who take insulin injections die at more than twice the rate of those given non-insulin treatments. And so I don't think many people are aware of this, that the longer you take insulin, the shorter your life expectancy becomes. So it's a short-term solution causing worse long-term health problems. It increases insulin resistance. It also increases fat storage. Insulin also causes weight gain, which also causes insulin resistance. And so the cycle continues and it never corrects the cause of the problem. So again, short term, it seemingly has the blood sugar under control, but beneath the surface, it's causing way worse problems long term. And at our workshop, we're going to be talking about uncovering and getting down to the cause, the source, and the root of where insulin resistance comes from and how to correct it so that an individual can reduce and even get off of this horrible medication with horrible side effects. Januvia is another one of those that can cause serious side effects, including pancreatitis, which actually leads to death in many cases. It's known to cause heart failure, kidney problems, which results in dialysis, low blood sugar, hypoglycemia, allergic and skin reactions, and even joint pain. And the most common side effects that we see with Januvia include upper respiratory infection, stuffy or runny nose, sore throat, and headache. So it impairs the immune system. And again, the longer you're on this, the greater the risk for other health complications, which end your life early. And when I say early death, people usually don't die from the actual condition or the disease. If you're on the medication long enough, you usually die from the side effects from the medication, which cause other conditions. This is a very real fact that needs to be paid attention to. And another drug for diabetes worth mentioning is Avandia, which has been shown in a study performed by drug safety reviewers from not just the FDA, but Centers for Medicare and Medicaid Services. They found that this drug, Avandia, may have killed about 100,000 people. More people died from this one diabetes drug than actually died in the Vietnam War. It's one of the most horrible scandals that we've seen, and it's still being prescribed today. The FDA restricted Avandia back in 2010 after studies linked it to the increased risk of heart attacks, and people are still being affected by this, harmed and even killed by this medication, even to this day. But it lurks beneath the surface, again, because of the indirect side effects that come off of these medications when taken for a long-term period of time. And lastly, I think it's worth mentioning metformin, because how many people do we know on metformin? And this drug was even recalled last year because of concerns that it was contaminated with carcinogens. And being on metformin actually doubles your chance of dying from a cardiovascular problem as well. So again, we find ourselves taking medications for one condition when in reality we're increasing our risk of death from another condition caused by the side effects of the medication. So how important is it to pay attention to this if your health and your life is important to you? We can't just keep sweeping this under the rug from one year to the next, thinking everything's okay just because our blood sugar is under control. Oh, I'm taking a blood pressure medication. My blood pressure is under control. Just because the blood pressure or the blood sugar medication levels all these things out, it doesn't actually mean that an individual is healthy. It doesn't mean that it's corrected the cause of the problem. Prescription drugs don't create health. All they do is change body chemistry, and they all have side effects. So the strategy and the correct thinking would be, what do I need to do to get to the cause of this, why I have this condition in the first place? Because the prescription medications aren't curing that condition. They're not. And I think we all know that at some deeper level. In a large Accord study of more than 10,000 diabetics, they found that aggressive blood sugar lowering medication actually caused deaths. And this is printed in the Journal of the American Medical Association. And so one of these studies called the Diabetes Prevention Program, a research study showed that lifestyle changes are even more effective than drugs like metformin in reducing the incidence of diabetes in people at high risk with lower costs and fewer side effects. So we know this. It's a fact that you can actually reverse diabetes. You can reverse type 2 diabetes. It's 100% reversible with no side effects from implementing proper lifestyle choices. So you can learn about these types of strategies. I'm going to talk exactly about this to the T, leave no stone unturned at this upcoming workshop. So learn how to reverse type 2 diabetes in as little as a week. Yes, we've had people reverse their diabetes and stabilize their blood sugar in less than a week. You can learn how to stabilize your blood sugar at any age. And I'm going to show you how to lose your easiest 10 pounds ever as a bonus. Your body just releases fat that it doesn't need when you start implementing these strategies. How to have better energy than ever, prevent Alzheimer's, cancer, heart disease. And also I'm going to be discussing the top 3 research proven blood sugar stabilizing supplements. So you can learn all about this and a whole lot more at our upcoming Diabetes and Blood Sugar Control Workshop. It's coming up Monday, June 6th at 5:45. So please make sure that you register yourself, your family members, friends, loved ones. Who can you think of right now that needs to be here? For some people, it's a matter of life and death. And we all have a responsibility. With great knowledge comes great responsibility, not just for yourself, but to help others. This information is life-saving and life-changing. So please make sure that you reserve your seats now. This is going to be an amazing event. I look forward to seeing everybody there. I love and appreciate you. God bless.